Cormaigh Kearley. I too would like to welcome Minister Lynch back to the House. I would like to take this opportunity to congratulate her on the excellent work that she has carried out to date, and I look forward to continuing to work with her in the area of mental health. As I've said before, I have a particular interest in this area as I have a child with a moderate intellectual disability, and I must say I think I'm well qualified at this stage to speak of the lack of services in this area in mental health and in the area of disability. I would like today to highlight where I think we need the change and where we urgently need change, is to speak about two constituents of mine, but two people who are also very, very good friends, who have suffered greatly from the lack of services and the lack of availability of services in this country. In the last 2 years, a young friend of mine had attended her GP on at least 20 occasions, and I know we say you would spend every single penny that you have to get, you know, to have the system, the person made better, but at the same time I think, you know, most families have to look at in terms of monetary value as well. Visiting your GP for 20 occasions over 2 years at €50 a head, you know, putting it down to brass taxes, you know, is quite a lot of money. On each visit that this girl made to her GP, she was prescribed antidepressants, either increases of dosages each time or prescribed a different antidepressant. When no progress was made, she was referred to a psychologist who saw her twice at a cost of €80 a session, and then was referred back to the GP, where she continued to go for another few months. Asking for help on every single day, this girl was then referred on to a psychiatrist, which she saw 3 times. The first time at a cost of €300 for an initial consultation, and the remaining 2 on €180. Despite this, the patient was making absolutely no improvement and begged to be admitted to hospital. On one occasion saying to me, "If I was a dog in pain, you would do something to help me. Can nobody in this country help me?" Coming from a 19-year-old child, I think this is absolutely atrocious. Eventually, the psychiatrist agreed to admit this girl to hospital, and they were told they would have at least a 4-week waiting list. This was to be admitted to one of our private psychiatric hospitals. They were given an option of 2 hospitals. Every single day, this girl's parents, her GP, everybody rang and pleaded with somebody to admit this girl for help. It took numerous daily phone calls, highlighting each time the fear for this person and for this patient's safety, to 2 separate hospitals. After 4 weeks, they were eventually admitted to a hospital here in Dublin. The other psychiatric hospital came back to the parent after 11 weeks, offering her a bed. And the attitude was, "You'll have to wait." How can we say to somebody who is suffering from a serious depressive illness, "Sorry, we haven't got a bed. Can you put off your suicidal thoughts for 4 weeks?" It is absolutely atrocious. This particular patient, as I said, was being treated at the highest level available, and still her family saw a visible decline in her mental health. Before being admitted to the hospital, the patient was assured intensive and psychiatric care, which gave her a feeling that when I get into hospital, I'll be okay, people will look after me, and that just did not happen. This girl spent 11 weeks in a hospital here in South Dublin, and came out of hospital, was told, "Well, that's as far as we can go, take the tablets," absolutely in a worse condition than when she went in, and was told, "That's it, away you go." When she was discharged, she was given a further appointment. Her mother tried to meet with the consultant on the day of her discharge. Twice they rang through to other wards, couldn't get to speak with the doctor, and eventually had to make an outpatient appointment. When the girl went up for the outpatient appointment, she was horrified to discover that the appointment was made with a separate doctor, a doctor whom she had never met in her 11 weeks in hospital. And when the mother rang and asked could she not see the consultant who had been treated her, was told that this particular consultant hadn't seen an inpatient as an outpatient for over 11 years. And in my book, that is absolutely atrocious. We need to give follow-up. The biggest thing that we need to give people in this country who have mental health issues, who are suicidal, who suffer from depression, is the feeling that we care. They need somebody that believes in them, not somebody to lecture them, but somebody to care. And if we are paying this kind of money for psychiatric services, why can we not get a follow-up with a consultant who treats them? I just don't, it beggars belief. Another, I'm aware of the time, another friend of mine who, another friend of mine who actually took his own life just 4 weeks ago, again had asked to be admitted to hospital for help. In this case, his family were also told there would be a 4 to 6 week waiting list, and he was eventually admitted to a psychiatric hospital, a psychiatric wing of a general hospital in my constituency. When a bed eventually did become available in a psychiatric hospital and the patient was due to be transferred on a Friday morning, there was no doctor available to sign the release form to allow this patient to be transferred. This man's wife had to tell him that he was going to have to stay there for the weekend before anybody could sign the release form for him to be transferred. 1 hour later, this man was dead, had taken his own life. He was so scared, he was so alone in this hospital. They were the things that he conveyed to his wife. As I said, it reiterates what I've said about people knowing that somebody cares. This was a young man with a young family who pleaded for help from our health system like so many more and was failed miserably. We have to make this vision for change just that, a much changed vision from the system that's currently in place. And once again, can I say that again, it's an example of our most vulnerable being the ones that suffer the most. I would also just like to mention briefly, and my own child's school, there are 3 18-year-old children who are leaving the school this year with no placements. They left the school last Friday week and have absolutely nowhere to go. And their parents are totally distraught that this is it. If a child leaves secondary school, there's always something in place. There's always something, or there's always somebody there to help. These children left the school without a goodbye, without one of these, what we have, these graduation ceremonies, or without a card, without a letter of good luck, nothing, and are left out. For the parents now, hopefully, you know, we're working on something that can be in place for them. But I just think the whole system is so unfair, and as I said already, it's the most vulnerable that are suffering the most. Recently I attended an absolutely excellent conference organised by the charity So Sad, Save Our Sons and Daughters, which was founded by a Louth man whose son had committed suicide a few years prior to this. And to put this suicide in context, on that day they mentioned there were 527 documented deaths by suicide in Ireland in 2009, but it is actually thought that the figure is much higher because it doesn't take into account non-accidental drownings or road fatalities. In 2010 the figure rose to 700. This excellent conference this group was founded, as I said, in Drogheda. It has now expanded right across Louth, Meath and Cavan, but receives calls from all over the country. One of the most important services that So Sad provides is this listening service that I was talking about earlier. And I must just say that So Sad are a totally charitable organisation. They receive absolutely no public funding, and I would like to ask the Minister to please look into groups like So Sad in our area that provide such an excellent service. To date they have saved over 250 lives by providing this follow-up service, and I would ask please for the Minister to look into situations like that. Thank you very much. Thank you.